Hello, 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 everyone. I am sure you are here for a reason. And I just want to welcome you to the Empower New Nurses um, show. I would say today I'm Dr. Miriam Smith, the host for Empower New Nurses. And so we need to have a sense of humor because the patients are looking at us and they're looking at us in many ways and from different perspectives. They want to see someone who is able to help them, not just physically, not just spiritually, but emotionally, socially. Our patients are looking at us from all different angles and they're looking for help. They came to the facility to be helped and not to be harmed. And so today, I'm delighted to talk a little on music therapy. From my experience many, many years ago, and even till recently, having gone and having taken care of patients, seeing them listening to music, here they might be singing or writing or doing something with music that enhances, that helps them in their illness, during their illness. And it helps in many ways. For example, some of these patients, they might write their experience in a song. Some of them, they might just sing it out, you know, and sometimes you pass by the bedside of some patients, they have the music on, or they have the music very low. They don't want to disturb anybody else. And sometimes when patients are having pain and sometimes severe pain, they might be singing a song or they might be listening to some because um, it would, as it were, divert their mind from the pain, the physical pain itself, to something more pleasant. It alleviates stress. Did you know that? Yes, music does. Even for the person who is not physically ill, your mind might be like strained or you might be feeling a little down and you put on a lively music. It motivates you, you know. So these are some of the reasons why music is so, so important. What it does, it helps physically, emotionally, yes, and cognitive. Now, just think about this, what it does by listening to the music, by just listening. It helps you to verbalize listening. You start verbalizing some of the feeling that you might be experiencing. The anxiety by listening, it lessens the anxiety. Take you to another world. Take you to another sphere. Take you to another environment mentally. So it does. It keeps you communicating. It helps you to connect with others. Music does that. So there are times you might see your patient, as my young nurse, you might see your patient feeling down and out. And if they have a song and if they have the music device, whatever some of them, just encourage them to listen to a song. Some of them will be singing, and sometimes you just have to pause and acknowledge them for that. Music plays a very, very important place in many patients' lives as they're waiting sometimes on their diagnosis, or they might be there waiting on their family, or they're waiting on something when they hear nice music, soft music. Depend on the patient, of course. They're for different age groups. One type of music does not fit for everybody, but definitely music is a universal language. So because of that, people express themselves. People's needs are different. Their needs are different. And so music can be one of the methods of helping them to alleviate or cope even in their strange environment. So whenever you see a patient sometimes looking down and out and not sure of what's happening, you can also ask them about their music. That can help you with a conversation. That can lead to them listening to some music that would soothe and help to help them to cope in this strange environment. So as a nurse, as a healthcare personnel, you can be an advocate for that patient. Yes, as you sit and you talk with your patient, music can be one of the therapies that can be recommended for your patient. Of course, your patient care is individualized. It's not going to be for everybody, but it has a role where it plays very significant way in helping them to cope in their hospital stay or in their healthcare, the facility, because there's so much. And this is just part one. This is just a little part of what will be coming next. But definitely, I'll be exploring and I'll be expanding on music therapy for the patient in the care, whether it's a home, whether it is a facility, whether it's a rehab, or whether it's in an acute setting. Sometimes just a soft music does make a difference. All right. So I'll talk with you on that. You can connect with me. And if you have any suggestions, we welcome that. You can connect with me on YouTube at Miriam Amanda Smith and podcast, Mayor, and Instagram. And of course, my podcast, Empowering New Nurses. And in my book, I do have a segment on humor. And humor, yes, little connection there, a little joke here, a little joke there that can help along with the patient's recovery. So the book is Nurse, the Guide to Empowering New Nurses in the Delivery of High Quality Care to All Patients. This book can be found on Amazon. Amazon is one of the best sellers. My young nurse, if you have not yet gotten your copy, get your copy. You will experience for yourself what I'm talking about. All right? And those of you who are nurses, young nurses especially, who have just started recently or even a while, and you want to gift them, that would be great too. That will be you participating in their nursing journey. So thanks for doing that. Leave a comment, leave a helpful comment. Also, a topic that you would like us to discuss and share your thoughts. We welcome that. Have a great day. Bye.